to all. This is Mrs. Rajalakshmi Murthy. Today we are going to discuss about breech presentation. I hope everyone know about normal presentation and normal mechanism of labor. So this is a one type of abnormal presentation. So first let I discuss the title first. Breech. So what is meant by breech? Breech means this buttocks region we can consider as a breech. Buttocks, bum, butt, whatever it depends upon your wish. So that is a breech. Okay. Then presentation. Presentation means the part which is the fetal part which is coming out of the womb. So during that time, the which part is appearing. So that part we can consider as a presentation. So first one is the breech. If it is coming, that is a breech presentation. Clear? Okay, so this is the normal position of presentation which the baby, the fetus, which is inside the normal position is LOA, that is a left occipital anterior. The always baby is in this position only, this presentation only. So when it is in opposite direction, that time we can consider it as a breech presentation. It's a one type of mal presentation. This is a abnormal presentation. Okay. Here lot of varieties are there. Complete breech, frank breech, footling breech, kneeling breech. So one by one we can discuss detailing. Next, please. So why I have pasted this image means for differentiation purpose I have posted this one. So breech presentation means the baby how it is sitting normally, how we are sitting the same like this. The fetus is sitting inside the womb. That is a breech presentation. This is a abnormal presentation. Then cephalic presentation. This is a normal presentation. The cephalic means that is the head part we can consider as a cephalic. Podalic means the buttocks part, sacral region we can consider as a podalic. Okay, clear? Okay. Next, in breech presentation, the lie is always longitudinal. Okay. Then the podalic pole present at the pelvic rim. See, this podalic pole present at the pelvic rim. This one we can call it as pelvic rim. This part. Another line I have differentiated. Sorry. This is the pelvic rim. So the podalic pole present at the pelvic rim. Okay. Next. Next, we can move on to the incident rate. The incident rate is more if the mother is in 28 weeks of gestation. 20% at 28 weeks of gestation, it drops down to the 5% at 34 weeks of gestation and 3 to 4% at term. Means what? So here the 28 weeks means obviously the mother is in preterm. If suppose the mother is in preterm period, during that time the mother could have a spontaneous delivery or because of any causes, there may be more chance, that is a 20% chance to have a breech presentation. Why? Because its mother is having a lot of space in the uterus, the baby is in very small. So that is the one reason. Then it drops down to 5% at 34 weeks of gestation because the baby has grown up. Then term is again it is reducing 3 to 4%. Okay. Then there's in 3 out of 4 means the 4 mother, in that 4 mother there are 3 mothers could have spontaneous correction by own. Spontaneous correction it will be happen in the 34 weeks of gestation. Okay. The incident rate in hospital is very low and where high parity births are minimal and routine external cephalic versions done in antenatal period means in the antenatal period itself the external cephalic version is done in the high parity births. High parity births means the mother is given more 3 or 4 more births, so that mother could have an external cephalic version in the antenatal period itself. Next, please. Here the varieties are there. That is a complete breech, incomplete breech. Complete breech when it is called, both the extremities, upper and lower extremities have completely flexed. So that time we can consider as a complete breech. It is otherwise called as flexed breech. Okay. Here the normal attitude of full flexion is maintained. I already told you both upper and lower extremities completely flexed in manner. Okay. Here, the thighs are flexed at the hip and the legs are flexed at the hip joints. Here, you can able to say, sorry, this one. The thighs are flexed at the hip joints. This is the hip joints. These legs are flexed over the thigh. Okay. Here, the presenting part is two buttocks, then external genitalia, then 2 feet. This is the presenting part. It is the most commonest breech presentation in the multipara mother. Flexed breech is the most commonest breech presentation. Okay. Here the incomplete breech, when we can call it as incomplete, because there is no proper flexion is achieved both extremities. So during that condition we can call it as incomplete breech. Incomplete breech, breech with extended leg. There are varieties, three varieties are there. Breech with extended leg, that is otherwise called as frank breech. For this condition, so this condition, frank breech or extended leg, we can call it as. This is most commonly present in the antenatal mother that I'll be tell you later. Then foot link breech. Foot link breech means the lower extremity is one of the legs coming drop to the lower segment of the uterus. That is a foot link presentation. Then knee presentation. Knee presentation and foot link presentation, these both in the very rare in condition. This is a common in antenatal mother. Clear? Next please. So here are the varieties. Frank breech or extended leg. So the lower extremities are extended, the upper extremities as flexed. In this condition we can call it as frank breech or extended leg. This is a one type of incomplete breech presentation. Complete breech means both extremities are flexed in manner, so that we can call it as complete breech. Then foot link presentation means one of the foot leg, it's coming down to the lower extremities of the uterus. Okay. Then knee presentation means the lower extremities in knee has flexed. The knee part is present over the presenting part. So that we can call it as a knee presentation. That is the knee has coming to the lower extremities of the uterus. Okay. Next one is breech with extended leg. Breech with extended leg is otherwise called as frank breech. In this condition, these thighs are flexed on the trunk and the legs are extended at the knee joints. Here, these thighs are, this one call it as the thighs. Thighs are flexed on the trunk. Trunk के सामने flex हो गई. Then the legs are extended. These legs are extended at the knee joints. Knee joints and all extended. The presenting part for frank breech, the presenting part is two sacrum or buttocks, then external genitalia. This is a presenting part for frank breech. Then it's commonly present in primary gravida. Why it is commonly present in primary gravida? The primary mothers having tight abdominal wall and good uterine tone. Then because of that, early engagement of the breech is happened. Okay, clear. The frank breech, the antenatal mothers, the early engagement also, it is occur too soon. The next one is foot link presentation. Foot link presentation, one of the foot is coming to the lower segment of the lower part of the uterus. Both thighs and legs are partially extended. Here, these thighs and legs are partially extended. Partially means it is not completely extended. Completely, no, it's not completely flexed. Okay, partial. So that condition we can call it as partially extended. These thighs and legs are partially extended and presenting at the brim. Okay. This is 25% of mother could have foot link presentation. Knee presentation, here these thighs are extended. This one we can call it as thighs. These thighs are extended. Foot link presentation, these thighs are partially extended. Here fully extended, but knees are flexed. These knees are flexed in manner, and these knees bringing to down to the present at the brim level. Clear? These two varieties, the foot link presentation and knee presentation, it's very uncommon condition. Clear? Next please. Based on the clinical varieties, the breech presentation is divided into two parts. The next one is extended leg, extended arm, cord prolapse. Along with this, if they face any difficulty during vaginal delivery, the breech presentation. So these conditions are not called complicated breech, but are called complicated or abnormal breech. It means if the mother is having frank breech or extended arm, cord prolapse, or any difficulty when they are conducting breech delivery through vagina, so during that time, that is not called as a complicated breech. It means that is not that much complicated, but it's a complicated or abnormal breech delivery, like that we can able to say. Clear? Next. Next one is etiology. So, what is the cause for this breech presentation? The first cause is prematurity. I already told you, preterm means that is a before 37 completed weeks of gestation. So, during that period, the fetus is very small, the uterus is large, so there may be chance to engage the breech. So, because of that one, because of that reason, the prematurity is one of the cause. Okay. Next one is factors preventing spontaneous version. It means spontaneous version means the fetus itself it's rotate itself in the cephalic version from the breech to podalic version to cephalic version. So what are the factors that preventing जो फैक्टर है वो स्पॉन्टेनियस वर्शन करने के लिए प्रिवेंट करे वही फैक्टर भी हमें लोग देखना पड़ेगा ठीक है the first one is breech with the extended leg. Breech with the extended leg, obviously, the there is no space in the uterus. The fetus also cannot able to move. So that conditions, this condition, they cannot able to move the spontaneous motion. Then twins pregnancy. There is no space in the uterus because the two twins are locked together, so that conditions and all they cannot able to move. Then oligohydramnios, there is a lack of amniotic fluid volume. Because of that also the spontaneous version has to be prevented. Then congenital malformation of the uterus such as septate or bicornuate uterus, these congenital malformations it will be happen during the period itself, means the mother when he is in childhood period itself it is affected congenitally. So that conditions we can call it as bicornuate. This one is a bicornuate and septate uterus. Septate means in between the uterus there is a septum. Suppose the baby has formed here, so they cannot able to rotate. Then bicornuate uterus also the uterus has divided into two parts. So these conditions also the baby cannot able to go for spontaneous version. Clear? The next one is a short cord. The umbilical cord length is also very small. During that conditions also they cannot go for spontaneous version. Then intrauterine death of the fetus IUD. IUD conditions also fetus itself it cannot move. Okay. The next one is favorable adaptation. Favorable adaptation means the head comfortably sitting on the fundus region. So what are all the factors? So that things only favorable adaptation. The first one is hydrocephalus. Hydrocephalus means it's a large head. It accommodates the wide fundus. For example, I'll draw the uterus here. This is a uterus. Sorry, I am not well versed in the drawing. So this is the uterus. Here, if the baby head is very large, so it will be adapt in the fundal region, well accommodated in the fundal region. Then next one is placenta previa. Placenta previa, the lower segment of pole, it is occupied by the placenta. So that conditions also head is not going to engage here. Then contracted pelvis. Contracted pelvis means the pelvis very small in structure. So this small pelvis, the head cannot be able to engage. The next one is cornofundal attachment of the placenta. Cornofundal attachment of the placenta, it minimizes space of the fundus where the smaller head can be placed comfortably. This is the fundus. Okay, what is meant by cornofundus? This part, 1 minute. This region is the fundus. So what is meant by cornofundus? So cornofundus means you suppose the placenta has attached here. The placenta has occupied in the half of the space here. So within this small space, the small head as can able to engage in the fundal region. Okay. The next one is undue mobility of the fetus. Undue mobility of the fetus cannot able to move. Hydramnios, that is a polyhydramnios conditions also, large amniotic fluid conditions also, the fetus cannot able to move properly. Then multipara with lax abdominal wall, then fetal abnormality, trisomy in anencephaly. These conditions under fetus cannot able to rotate, then move also. Okay, clear? The next one is recurrent breech. Recurrent breech means reoccur whenever the mother is get pregnant. So always the mother have breech presentation, and it always ends with the successive pregnancy. So these conditions we can call it as habitual or recurrent breech. Here, so what is the cause for this recurrent breech? What is the cause? The cause is main thing congenital malformation of the uterus. I already told you that is a bicornuate uterus or septate uterus. For these conditions, these all the things is a congenital malformation of the uterus, except this. This is a normal one. Mm, this is a normal uterus, but when compared to this, all other things, congenital malformation of the uterus, the condition which it is showing, that is a bicornuate uterus or septate uterus, unicornuate, whatever. It depends upon the uterus, the mother. It depends upon the congenital anomaly. The mothers always have this breech presentation. Then either repeated corneo-fundal attachment of the placenta. It means I already told you if the this part is the carnal part. So if the placenta is attaching here, the small head of the fetus can be engaged here. So always it represents the breech presentation. Clear? Next, please. Diagnosis. So how we can diagnose this breech presentation based on the clinical, based on the sonography. By the sonography method, sonography means that is a ultrasound. Okay, it confirms the clinical diagnosis. Clinically, first they will diagnose by doing antenatal examination. After that, they can go for this USG, especially in primary gravida with engaged frank breech. Primary gravida mostly extended leg or frank breech will be there, or with tense abdominal wall or irritable uterus. So they can in USG they can find the which type of breech presentation. Then they can detect the any congenital anomaly of the uterus, bicornuate or septate uterus like that. Then what type of breech, then what is the biparietal diameter, gestational age, weight of the fetus, everything, the amniotic fluid volume, then placenta where it is located, everything will be found out from the ultrasonography. Okay. Then in clinical assessment by antenatal examination for complete breech, that is flexed breech, how they are identifying. The first one is fundal grip. I hope you all know about the antenatal examination. This part we can consider as a fundus. Okay. So fundal grip, here they can find out head, that is a hard mass suggested. So hard mass will be visible here, and it will be palatable. Palatable means there will be some movement. Okay. Then lateral grip may one side is continuous mass will be felt, that is a fetal back is one side and the irregular limb to the other side. One side is continuous mass, that is a this one is the continuous mass, that is the spinal cord. Then irregular limbs will be felt at the other side. Okay. Then uh, pelvic grip. Pelvic grip means here. For this part, we can call it as pelvic grip. The next slide I will show you. In pelvic grip, so what it is? Breech, suggested by soft, broad, and irregular mass. So the buttocks part, that is a breech region, is a very soft and broad and irregular mass will be there. Breech is usually not engaged during pregnancy. This complete breech, it is not engaged usually. So, in that extended leg or frank breech, it is engaged, but in this complete breech, it is not engaged. Usually, during pregnancy period, it is not engaged. Okay. Then FSR, where they have detected FSR usually here in the higher level around the umbilicus. Usually in LOA, we can see this one is the umbilicus. See this one is the umbilicus. This part is the umbilicus. So in LOA we can able to see the FHS below the umbilicus for this side or this side. LOA means this side, ROA means this side. But in breech presentation, the umbilicus always we have to hear above the higher level of umbilicus for this side or this side. Okay, clear? Next, during pregnancy, soft and irregular parts are felt through the fornix. But PV examination, when they are doing pregnancy period, during that time they can feel this type of parts. Then during labor, PV palpation of ischial tuberosity, they can identify the ischial tuberosity, then sacrum, and feet by the sides of the buttocks, and foot felt is identified by the prominence of heel, lesser mobility of the grade 2. So when they are doing during pregnancy, during labor, PV examination, they can able to identify ischial tuberosity of the pelvic bone, uh, then limbs, buttocks, everything they can able to identify with the PV examination. Okay. Before slide, I have said ischial tuberosity of, by mistakenly I have said ischial tuberosity of the pelvis, not a pelvis, ischial tuberosity of the fetus. When they are doing PV examination on the board, if the mother is in labor during that time, the obstetrician is doing per vaginal examination. So which part she can feel? So that is a ischial tuberosity, then external genitalia, then limbs. So this is a part will be felt by obstetrician when they are doing PV examination. Clear? Next. The next one is frank bridge. Frank bridge. So this is a pelvic grip. I have said in the yesterday. Sorry, last slide now. So that is a pelvic grip. The frontal grip is here. Fundal grip the same like that, hard mass will be felt, but it is not palatable because of this. In front of the head there is a limbs or there is no movement here. Then head is non-palatable due to splinting action of the legs on the trunk. Then lateral side, one side is the continuous mass, that is the spine, the other side is the sides of the limbs. Irregular parts are less felt on the side. Here irregular parts is very less because these things are extended now because of that. Then pelvic grip, small hard and conical mass. This one is, we can call it as conical mass. This one we can consider as a conical mass. Mm, Small hard and conical mass is felt. The breech is usually engaged. This type of frank breech usually engaged during pregnancy period itself. Then FSH will be here, where we can hear, located at the located at lower level in the midline due to early engagement of the breech. See, this is the umbilicus. If the breech is engaged, frank breech, if the breech is due to early engagement of the breech, lower level in the midline means here. This is the umbilicus. Usually the complete breech above the umbilicus, here or here we can able to identify the FHS. Here because of engaged breech we can able to hear this place, lower level of the midline means here. Okay. Next one is for vagina during pregnancy, hard feel of the sacrum felt often mistaken on the head. Obviously, the leg has the thigh part is flexed means here is a ridged part will be there, so it will be misconfused whether it is head or sacrum. Then during labor, palpation of the ischial tuberosity, anal opening, and sacrum only. During labor, when they are doing the baby during that time, when they are doing the PV during that time, ischial tuberosity and anal opening and sacrum will be present. So in breech presentation, what all the positions are there? There are four positions. That is, the first one is left sacroanterior. This one is left sacroanterior. Uh, i- then if it is keeping here right sacroanterior, yeah, see, if the baby is in facing here left sacroanterior, if it is here right sacroanterior, if it is here right sacroposterior, left sacroposterior. So there are four positions will be there. The denominator of breech presentation is sacrum. The everything you have to say when you are telling the when you are telling about breech mechanism of labor. So sacrum is the denominator. In anterior position, sacrum is directed toward iliac pubic eminence, and posterior position, sacrum is directed to the sacroiliac joints. It means anterior position. This one is the anterior position. The sacrum. This sacrum is directed towards the iliopubic eminence. See, this part is the sacrum. This sacrum is directed towards the this iliopubic eminence. This is the anterior position. In posterior position, this is the sacrum. This sacrum is direct towards the sacroiliac joints. Sacroiliac joints will be here. This part is the sacroiliac joints. Okay, so that things only they have mentioned here. The next one is these are all the positions. Uh, we have seen what is meant by breech presentation, what are the types and clinical varieties, then diagnostic findings based on the antenatal examination and sonography. Then the breech presentation will be continued in the next video. So after this, if you have any doubt, let me know. Please put it into the comment box. Then I'll make the other video about mechanism of labor in breech presentation. Learn the basic concept. Learn easily. Learn simply. So all the best for to become a smart nurse. Thank you.